Welcome back. So, call it complementary, alternative, or integrative medicine. There are many definitions for this form of healthcare, which is said to be a coordinated way of bringing conventional and complementary approaches together for better health. To tell us more about integrative medicine is a medical practitioner, Dr. Ifeyinwa Nwakezi. Good to have you here this morning.
Good morning. Thank you so much for inviting me.
You look good.
Thank you. Thank you.
Okay, so let's lay it on the table. You are a medical practitioner.
Yes, I am.
Okay, and then you're also into integrative medicine.
Definitely.
So, some people are wondering, okay, integrative medicine, is it not the normal, conventional that we all know?
Okay, yes, I'm a medical practitioner. I graduated from University of Ibadan in 1979. And during my life experiences in coping with the rigors of daily living, I started having some negative health effects. And they actually diagnosed me, said I was having anxiety neurosis with reactive depression. But the truth about the matter is that all the drugs they were giving me were not cutting to the chase. They were not dealing with the root of the matter. My lifestyle, my eating habits was causing my ill health. But I was being given diazepam, Inderil, and it wasn't doing much for me. So I had to now consult a doctor in London, a doctor that is into complementary medicine, what is called integrative medicine. And he looked at me and said, Ify, you are not really sick. Your lifestyle is making you sick. Go back to Nigeria and work on your diets. Change your acidic diet to alkaline diet. I was eating mostly starchy foods, mostly meat, and not enough fruits and vegetables. And he now said, go back to Nigeria and change your lifestyle. Change your eating habits, and I'm sure you're going to get well. By the way, he did a lot of tests on me and found that I had a lot of alcohol in my system. My body was making alcohol, yet I wasn't drinking alcohol. It was the acidic food that I was eating that was being fermented in my system. Because when you oxidize your food, you get energy. But when you ferment your food, you get a lot of fatigue. That's why there is fatigue all over the place. So I started changing my diet, and of course I came back and my health started improving. But let me say something here. Health is not just about diet. It's also about your total being. WHO defines health as a state of complete spiritual, mental, emotional, and physical well-being, and not merely the absence of disease or infirmity. And that is where integrative medical doctors come in. They focus on the whole person, not just an organ that is diseased. They look at health from the holistic perspective. Your age, your lifestyle, your diet, your exercise level, your stress level, and especially your mental and emotional life. How are you managing your mental and emotional life? Are you the kind of person that is so negatively programmed? And of course, it will be affecting your immune system. So they are managing health from the whole perspective. They're looking at the root causes of illness, not just treating palliatives. Mm-hmm. That is where our medical doctors, we have to try and get it right. Our medical doctors are doing very well, but I think there has to be continuous education.
Because I'm just thinking, just
Yes.
as you're saying that the orthodox medicine that we've all known for a long time, they also preach all of this. It preaches that you have to combine, good food with exercises and, having positive mental, abilities. So what's so different from, this and integrative medicine?
Okay, the truth about the matter is that our medical doctors are so inundated with a number of patients, they don't have time to sit through and counsel the patient on the deep root causes of their illness. Our medical care is so focused on disease care. That is one aspect of the matter. You need to be able to get to the root of the illness, and you need to begin to counsel patients that illness is actually related to their lifestyle. It's related to their eating habits, it's related to a negative mindset, it's related to lack of exercise, and it's related to lack of proper water. Most of the water we drink, for instance, I'll use this cup to make sure my water is alkalized. Most of the water we drink that is all in
What's in the cup?
This cup, it has some energy balancing that actually changes the molecular structure of the water. Most of the acidic water we bottle in our bottled waters, they are mostly acidic. Their molecular structure is in such a way that it don't get into the cells of the organs. And the truth about it is that people are drinking water and the water is not rehydrating their cells. So there's a lot of chronic dehydration all over the place.
And then you mentioned earlier, sorry, Nyota, about the diet that you were eating carbohydrates.
Mostly starch, yes.
Mostly starch. Isn't that what they say is good for us?
The truth about the matter
balanced
is that,
portions.
The truth about the matter is that the body is actually 70 to 80% water. And we're meant to eat more water-rich foods to make sure our blood is But the way we're eating, we have been the wrong way. We eat mostly starches and mostly proteins and mostly good foods. And most of those foods are denatured. The enzymes in them are gone, and they are not hydrating the cell because they are not water-rich. That's why they're saying you should take mostly fruits and vegetables. People that eat mostly fruits and vegetables, they tend to be healthier because their blood is usually alkaline. In an acidic environment, disease thrives because the toxins that are made by the organisms that actually eat on the food you eat is causing the illnesses that they call diseases. It goes from all over the body and affects different tissues and organs. And you know, that kind of thing, that is what is actually happening.
Dr. Nwakisi,
yes.
You've opened up some things here, so I'd like us to go a bit more practical here.
Okay.
You've talked about, let's begin with your diet. I mean, if you don't mind, you mentioned something when we're off air about your age. You're a grandmother of 8.
I'm 64 years old.
I could have sworn you were just about 45 or 50.
Okay.
But you're looking lovely.
Thank you.
Let's look at it practically. How should we, let's begin with eating, because then we'll now go on to talk about exercising. How should we eat?
Okay. I think that the Nigerian diet, the basic Nigerian diet is not bad. But I think the women in the house, we need to make sure that whatever food we're giving our husbands and our children, that we are giving them enough fruits and vegetables. That is what is lacking. We eat mostly cooked food. We should begin to look at all the greens in the environment. There's so many greens we have in this country.
But if I may come in here,
yes.
Even the greens now, because if you go, practically everywhere you go, everyone's talking, let's eat healthy. Let's eat. Even the greens are not being properly managed. So there is now that concern of when you're even giving the vegetables, how are you managing, how are you preparing it, how are you managing it?
Okay, that's another problem I want to get into. Most of our foods, we're not even sure the fertilizers are healthy.
Organic, yeah.
We don't have organic foods in Nigeria. But a lot of people who are getting into agriculture are getting into organic farming. But I guess it's much more expensive than the normal vegetables. But I believe that even if you go to the market like Ogo or Nubu, you know, bitter leaf, so you go and grind those things. I think that every family should have a juicer. There's so many of them in the market. They're not so expensive. Some of them are expensive. Some of them are quite cheap. You make sure you juice vegetables every day and include a lot of a big bowl of salads for your family. It will definitely help in moving the blood from acidic to alkaline.
Okay.
And there's so many other nutritional products. The problem about nutritional products is that there's so many things in the markets, in the health shops, and Nigerians are buying it. Most of them are just wasting your money.
So let's go back natural. Now, you talked about water. You said some of the water we drink most times are acidic.
Yes.
Now, that's going to scare a lot of people, especially those of us that drink from what we call the pure water.
The pure water.
Or the bottled water and all that. And then you tell you that, okay, what about those that drink directly from their boreholes? Are those waters cleaner? And how can we ensure that we have clean water besides boiling?
That's a bit of a difficult question for me because really, I'm very passionate about the water. There's a product that I'm sure my family